So my first presentation is post-transplant management in children with acute lymphoblastic leukemia. And I will focus on how to prevent relapse in those patients with a high-risk feature after allogenic stem cell transplantation. We perform a prospective multi-center, multinational trial for children and adolescents with high-risk acute lymphoblastic leukemia. And we already have recognized in a randomized fashion for more than 400 patients that the most common reason for treatment failure after allogenic stem cell transplantation is relapse, and no longer treatment-related mortality due to graft-versus-host disease, due to toxicity, or, for instance, infection. So we have to focus how to prevent relapse. Of course, we have different risk factors. So, for instance, patients who are transplanted in first remission have an excellent overall and event-free survival of more than 90%. If they are conditioned with total body irradiation and etoposide. And the reason for that also here is relapse and not treatment-related mortality, which is better compared, for instance, to the combination of fludarabine, thiatepa, and either busulfan or treosulfan. So what we do after allotransplant, of course, is to monitor relapse by frequent blood pictures, but also bone marrow punctures and measurement of minimal residual disease. We also have the possibility in those patients where, for instance, a signal is rising after transplant, or for those patients who were transplanted with minimal residual disease, to taper immunosuppression earlier than usual. That might prevent relapse, but in some cases, of course, it will not be enough. So another option, for instance, is to get rid of any immunosuppression, meaning to stop immunosuppression, which is a critical issue for those patients who suffer from graft-versus-host disease. And for that patients, we, for instance, could offer measures of extracorporeal phototherapy, which prevents the pharmacological side effects of immunosuppression of, for instance, corticosteroids, but also calcineurin inhibitors. And in this presentation, I will show a little overview on this practice, which is very popular now for children in Europe. So for us, it is very important to prevent relapse post-allogenic stem cell transplantation. And of course, prevention means monitoring, but also interventions, for instance, by stopping immunosuppression.